When you start to talk about broad span of control or wide span of control, there are a completely different set of advantages and disadvantages. Now, what is a broad span of control and what's a wide span of control? Well, this is whenever a manager or director or leader oversees a larger number of employees and direct reports. And the first thing we often hear when we're dealing with our clients and coaching them, and they're talking about span of controls that are very wide, is how do I provide oversight and training and leadership to all of these employees if I'm overseeing 30 people? And we've actually seen situations where managers are overseeing 38 or 60. And in nursing units, this is not uncommon. But it becomes very difficult for leaders to be able to mentor and coach and answer questions, especially in today's environment with we're dealing with so many new graduates, especially at the bedside and nursing areas. When you have high turnover like we're experiencing in healthcare and you have broad spans of control, it becomes extremely difficult to promote employee engagement, to stay engaged, and to actually mentor the employees, and more importantly, provide meaningful feedback on a continuous basis. There are reasons that really encourage wide span of control. Number one, it reduces costs. So when we're seeing the big headlines right now of healthcare systems reduce 38 positions, they reduce 45 positions, that's driven by cost. But we want to make sure that we're also balancing it by the needs of the organization. Because when you have a very high level of span of control, a broad span of control, and you're overseeing 40, 50, 60, 70 individuals, it can become overwhelming. And this has possibility of inadequate support. It can lead to poor quality. You can have poor patient satisfaction. And all of these things happen like role confusion. So with a broad span of control, you want to make sure that really focusing in on the right outcomes. So again, back to the question of how do I know the span of control is right for my organization? Well, it's going to depend. Even though critical access hospitals do have a higher threshold of what would be considered a little bit narrow, there wasn't a large difference when we're looking at the bands of the number of employees per executive or per VP per director. Overall, critical access hospitals, they range from about a 1 to 7 to a 1 to 14. And academic medical center short-term care range from 1 to 7 to 1 to 19. So that what you would consider very narrow, sometimes it might be referred to as poor performing or the bottom quartile, that performance level of 1 to 7 is the same. When we get to the broader spans of control, that's where we start to see a little bit of a difference. So the organizations like Critical Access tend to have a 1 to 14 or 1 to 15, and academic medical centers, short-term acute care, their higher thresholds 1 to 19, 1 to 20. Now, with that being said, there are systems right now that we do see that have a 1 to 22. We often see in what would be considered for-profit entities a 1 to 25. So it's important for you to understand where you're falling. But there are so many similarities. Again, when we look at critical access versus community hospitals and the C-suite VP levels, the ranges are similar. Critical access tend to have 3 to 7 C-suite executives to VPs, and short-term acute care medical centers tend to have 3 C-suite executives or VPs to a top threshold of 7 to 10. So there aren't as many differences as we would see.